start our class. Well, so we continue speaking about reassuring today. And now, so first of all, as far as you remember, we start our class with the discussion of the previous task. And so the first slide of the presentation is about the exercise that were given as a home task, as home assignment. And these are the sentences where the task was to use the verbs which are given in brackets in the active voice or passive voice, and present simple or past simple tense. And there were some mistakes in the sentences, in some of the sentences, which I placed here on this slide. And one of the most difficult sentence was the first one, which is given here as the first sentence. Let us look at the sentence and analyze and try to understand why we make mistakes in this sentence. So let us get started with Asna. So will you read the sentence?
The park gates are locked at 6:30 p.m. every evening.
Yes, you're right. Perfect. Are locked. This should be passive voice. Some of the students they wrote were locked. It's also possible in the past, but not only locked, because locked is or just lock. Yeah, because this is active voice. The park gates are locked by somebody. Yes, so we should use the passive voice here. Okay, and the second sentence was also a problem for some of the students. So Shamisha, will you read the second sentence, please?
Why she or resign from her job? Didn't she enjoy it?
I didn't get it. Will you repeat, please?
Why did she
Yes, why did she resign? Yes, she did it herself, right? So that is why we use the active voice here, okay? And the next sentence, which looks very similar, is for Ramisha.
Yes, ma'am. Why did Ben fired from his job?
It looks like the previous sentence, but the meaning of the verb fire is to make somebody do something, yes? To make somebody leave the job. That is why we should use passive voice here.
Why did Ben fire from his job?
The passive voice consists of two parts.
Was Ben fired?
Yes. Why
was Ben fired?
Why was Ben fired from his job? Okay. Now the next sentence is for John Farvin, please.
Yes, ma'am. Where were these pictures taken? In London? Did you take them?
Yes, you are right. So in this set of sentences, we have both. First, we have passive voice were taken, and then active voice. Did you take? Well, then, Hala Malik, please. Hala Malik. Is she here? No, Hala Malik. Minus. Yes, Hala Malik. Yes, please. About
the boat hit the rock and sank quickly. Fortunately, everybody was rescued.
Yes, everyone was rescued. Right. Okay, and then for Sultan.
Yes, ma'am. While I was on holiday, uh, my camera disappeared from my hotel room.
If we use the
Yes.
verb steal, what is the form
Stolen.
of? Yes, my camera
Was stolen.
was
Was
stolen.
yeah.
Stolen from my hotel room. Okay, good. And the last sentence is for Sinju.
Yes, ma'am. The letter was sent a week ago and it arrived yesterday.
Yes, good. So here we have first verb is used in the passive voice and the second in the active voice. Okay, so that were the typical mistakes that some of the students made, and so I'm glad that you understand the difference between these voices. And today we continue speaking about how to make sentences, conversation reassuring. So you remember we were listening to the conversation between a doctor and a patient. And so do you remember the doctor's name? Who remembers his name? No one. Okay, actually his name is Dr. Quinn. And so how does Dr. Quinn make his conversation more reassuring? You remember that reassure means to say or do something to remove the fears of a patient here. So, and when he was talking to the patient with the, about the gastroscopy, so the doctor uses in his conversation, he uses the adjectives to help make the procedure less frightening and such a way reassure the patient. So the sentences are: the tube will have a tiny camera and it's a routine procedure. So he uses the adjectives to emphasize that it will be not very dangerous or scary procedure, right? And if we move to the next slide, we can see the sentences, 8 sentences actually. And so here we need to understand which sentences are not very reassuring, and just change something in the sentences to find more reassuring, to make them more reassuring. So let us listen to Danish now. I read the first sentences and say if it is reassuring or not.
Yes, ma'am. First sentence is, it's a very simple procedure.
Does it sound reassuring to a patient?
Yes, ma'am.
Yes, because yes, so here we see that the doctor emphasizes that this is very simple, it won't be any problems with this procedure. Okay, so the next sentence is for Ashwati.
Yes, ma'am. We are just going to take some fluid from your backbone.
Mm-hmm. So the backbone is shown in the picture here. What is the synonym to backbone? The other word for this, which is shown.
Vertebral column.
Okay, and so is
I
this?
think it's assuring. I think it's reassuring.
Yes, because we are going is used here and just is used here. And some. Okay. Well, the next sentence for Taib, please.
Yes, ma'am. You will just feel slightly sore after the test. It's reassuring, ma'am.
Yes, so this is just and slightly. So the words that make this sentence reassuring. The next is for Labib, please.
Yes, ma'am. It will take 10 minutes. I think it's reassuring, ma'am.
Well, are there any words, any adjectives or other words that make this sentence reassuring? No, no. It's like the fact, yes? So the
Yes,
doctor
ma'am.
says that it'll take 10 minutes without any, he doesn't add anything just to make it reassuring.
Yes, ma'am.
The patient can be worried about this. How can we make this sentence more reassuring?
So,
We can
I
add,
can,
yes, only just here. So it will just
we
take
can say few minutes.
only
We
10
can say,
minutes. Yes, or few minutes. Yes, it will take few minutes. Okay. So the next one is for Hepzibah, please.
Ma'am, we haven't read the fourth point.
Sorry?
We didn't read the fourth point.
Okay, so yes, read it, please.
All you will feel is a tiny scratch, nothing more. Yes, ma'am, it's reassuring.
Yes, so we have the adjective tiny, and he adds nothing more. Okay. Well, now let us focus on which sentence? Number 6, right?
Yes, ma'am.
Or okay, so number 6 is for Ansila.
It only takes a few minutes.
So this is
Few minutes.
Yes, this is the example how we can change sentence number 5. Yes, and well, Asna, please, number 7.
It's not a pleasant procedure.
So, is it reassuring?
No, ma'am.
How can we change the sentence? Some students say, you should say, it's a pleasant procedure. So, is it possible to say like this? I mean,
no, ma'am.
Should we lie to a patient? And the students say, doctors always lie to their patients. Do you agree with this?
No, ma'am.
No,
ma'am.
we shouldn't lie, of course, yeah. So how can we change the sentence to make it more caring for the patient? Yes, Sindhu?
We can add another sentence with that. If we add, it's not a pleasant procedure, but it will only take a few minutes. Can add like that.
Yes, okay, it will be better. Right, thank you. And for the next sentence, Shamisha, please, what do you think of?
You will hardly feel anything.
Is it reassuring?
No, ma'am.
And what would you change in the sentence to make it better? Yes?
You will feel just a pain, nothing else.
You should, you would like to tell the patient about pain, but I think it's better to, he will be scared. I think it's better to say you hardly feel anything, and this sentence is very reassuring. Okay, now let's go to the next slide here. And so we were reading the sentences where the structure of the sentences was just helped the patients to relax. And here we are going to speak about emphasis. When a doctor say some of the sentence, mention some of the steps of the procedure, he emphasizes some of the words to make it also more reassuring to the patient. We're going to listen to statements and write the word the doctor emphasizes or stresses in each sentence. And the question is, why does the doctor emphasize the words? Now let's go into, let us just listen to the sentences, and you please make notes about the word which is stressed in each of the sentences. And you'll tell me if you can hear or not.
Listening 3. 1. Listening 3. 1.
Can you hear?
Yes, ma'am.
Listening 3. 1.
It's a very simple procedure.
2.
We're just going to take some fluid from your backbone.
3.
You'll just feel slightly sore after the test.
4.
All you'll feel is a tiny scratch, nothing more.
5.
It'll take 10 minutes.
6.
It only takes a few minutes.
7.
It's not a pleasant procedure.
8.
You'll hardly feel anything.
Mm-hmm. Well, in the first sentence, which word is stressed? In sentence number 1. Yes?
Very simple. Very simple.
Yes. Simple is stressed. In sentence number 2.
Just.
Okay. In sentence 3.
Just.
Slightly. Okay. In number 4.
Slightly.
Tiny.
Tiny scratch. Yeah. In sentence number 5.
10.
10. So you see, with the help of intonation, with the help of stress, the doctor can make the sentence more reassuring, not adding anything to the sentence. 10 is stressed. Yes, in sentence number 6, what is stressed?
Only.
Only, yes, it only takes. Number 7?
Pleasant.
Pleasant. So he says it is not, but he emphasizes pleasant procedure, okay? And in number 8, which word is stressed?
Anything.
Okay, this is also a way to help the patient to feel more comfortable. Well, and now, if we have a look at this slide, we can see that there is the description of the way how to explain procedures using the future to be going to. So doctors need to explain procedures before they perform them, so they can obtain patient consent, which is very important. And the future we'll be going to is usually used to explain a procedure even when the patient hasn't yet agreed to the procedure or given consent. So the be going to future is used because it is the clearest and most direct way to give an explanation. And when the procedure is fully explained, the patient can give informed consent. You remember that informed consent is the consent when the patient knows all the details and has all the information about the procedure. And the example here with the structure we go into, we are going to give you a mild sedative. So this is the example. And one more way of explaining the procedure to a patient, in addition to using the be going to future, doctors often use fixed expressions with what to explain procedures. So the examples, what we are going to do is to take a tiny sample from your scalp. Or what happens then is we are going to give you a mild sedative. What happens next is that we insert the needle. What we need to do after that is stitch the wound. Okay. Now, if we have a look at the next slide, we can see several sentences. These are the steps of some explanation of the procedure, and we should change the explanations to go into and simplify the medical terms. And where indicated, we should use the expression with what. So you see at the end of some of the sentences what is given in the brackets. So who did we stop with? I don't remember. Okay, let's listen to Ramisha. The first sentence, please.
A sample is taken from the bowel. And what we are going to do is take a sample from the bowel.
Or instead of bowel, what can we use? Or instead of sample, we can, because some of the patients do not understand what sample means.
Sample.
What we are going to do is to take what?
Take a sample.
Some tissues.
From
some tissues, yes, from your bowel. Okay, okay. So now, John Farvin, please. Number 2.
Yes, ma'am. Next, the end of the intestine, we going to attach to the opening of on the abdomen.
Did you use what? I didn't get it. Will you repeat, please?
Next, the end of the intestine, we going to attach to an opening on the abdomen.
We should add some other words after what. So who can help us with this sentence?
What we use, what we do next.
What will be happening next?
What happens next is, and to be going to?
Is the end of the intestine going to get attached to the to an opening of the abdomen?
Okay, or we can say what we are going to do is to attach the end of the intestines to an opening on the abdomen, right? What we are going to do is to attach like this. Okay, so the next is for Hala Malik.
Yes, ma'am. A sample is taken from the cervix.
Start with we.
We are going to take a sample from the cervix.
Okay, so good, thank you. Then Sultan, please.
What we need to do after that, a tube is passed through the urethra.
If you use active voice, try to use active voice. Yes, Sultan? So we do this, yes? Not the tube does.
Yeah.
So what?
We do.
So what do we do? What
We are
are we
going
doing? what we are
going
going.
to
Who can help
insert the
us?
tube into the urethra.
Who can help us?
What we are going to do
is
what we are going to do is to pass a tube through urethra.
Yes, perfect. Yes, Hala Malik, thank you. Well, the next is for Sinju.
Yes, ma'am. What happens next is the glands are removed from the axilla.
Okay, yes. Okay, good. Well, number 6 is for Danish.
Yes, ma'am. Number 6, what we are going to do is to remove some sample or tissues from the lung.
Good. Exactly. Okay. So now let's listen to Ashwati.
Yes, ma'am. Next, a sample is removed from the lungs. Next, what we are going to do is to remove a sample from the lungs.
What about 7?
After that, a tube is advanced down past the prostate into the bladder.
Start with what?
After that,
what?
What are we going after that is a tube is advanced down past the prostate into the bladder.
Or what we are going to do after that is to advance the tube down past the prostate into the bladder. So if we change into active voice. Well, then Taib, please, the next sentence is for you.
What a dye is then going to be injected into the pancreatic and bile ducts to visualize them.
Look, so it looks like we don't understand how to change the sentence using what. So I mean that we can use what we are going to do is, or what happens then is, what happens next is, what we need to do after that is. Don't forget about is. So please.
What we are going to do is that to inject the dye into the pancreatic and bile ducts to visualize them.
Okay, good. And so Labib, please.
Yes, ma'am. The muscle is repaired with a mesh. What happens then when the muscle is repaired with a mesh?
We're going to repair the muscle with a mesh. Yes, because the task is to use the future. Okay, good. Thank you. And so here, one more task just to think about is here, sometimes you may have to give a patient a brief explanation of a procedure. Now, let's explain the conditions using the expressions which are given here. So the expressions are a condition where, an illness where, a procedure where, a device which you use to. So it means we need to use some sentences, the structures with where and which. The example is given about anemia, which not enough pigment in the blood. This is the phrase which is given, and so when we explain the condition to a patient, we say like this: it's a condition where you do not have enough of a special pigment or coloring in your blood. So this is the way we should explain this. Now let us focus on the other conditions and procedures which are presented here on the slide, and try to explain this condition using where and which. So please, Hepzibah, number 1.
A procedure where appendicitis is inflamed and removed.
First, the procedure where inflamed appendix is removed. Yes?
Okay.
Because inflamed is not about removing, it's about this part of the body, right? Well, the next is for Ansila. Number 2.
Alzheimer's disease, someone memory loss, mood changes, pause, not. Alzheimer's disease, it's a condition where you lose your memory or mood changes and the cause is not well known.
Okay, good. Well, the next is for Shamisha.
Yes, ma'am.
Number 3.
The third one, ma'am.
Yes.
Hemorrhoidectomy, a procedure where the piles tie cut out.
Where the piles tie is cut out. Yes, is cut
Yes,
out.
ma'am.
Okay. Well, the next is for so Ramisha.
Yes, ma'am. Diverticulity sac, that it is a condition. The condition of the weak points get infected, inflammation or pain.
So I didn't get it. Diverticulitis. Where?
Diverticulity sac. It is a condition where the weak points the get infected.
Good. Points cut are infected. Yes. Okay. So the next is for John Farvin. Number 5.
Sigmoidoscopy is a device which is used to look at colon sample.
It's not a device. Sigmoidoscope is a device, but this
It's
is
a procedure.
where a doctor looks
at colon.
Looks at a colon
Colon
sample. Okay. Well, Hala Malik, please.
Anesthesia is a procedure where we need to put you into sleep.
Where a doctor puts you puts you to sleep. Okay, good. Well, so this is the way out to make explanation just more easy to be to understand to a patient. Okay, and now we'll read. We are going to read the leaflet that gives information about gastroscopy. Will you switch off the microphone, please, everyone? Now we are going to look only at the headings in the leaflet and decide what information each part of the text contains. So the first heading is, what preparation do I need to do? What will be this part of the leaflet about? So who can tell us? Yes. Who can tell us about this? Yes. There is a noise. There is a noise there. Everyone, please. So, who can explain what is given in this part of the leaflet? What kind of information? Yes, Hepzibah.
Yes, ma'am. What preparation do I need to do? The cells that the preparations that the patient while we are giving an information about the gastroscopy, what preparations need to be done by a patient while preparing for a gastroscopy.
Yes, before the gastroscopy. Yeah. Okay. What can I expect after a gastroscopy? What is this about? This part of the leaflet. What is it about?
This test.
Yes, Hala Malik.
It's after the gastroscopy procedure, the person may feel some uncomfortableness. So doctor will mention that uncomfortableness.
Okay.
That
Okay. I see. Okay. Unfortunately, we have less than 1 minute. So let us take a break and see you in 10 minutes. Okay.
Okay, ma'am.